Everyone. After already we will learn about the topic Tourette syndrome or Tourette disorders. What means syndromes or Tourette disorders? Definition: Tourette syndrome or Tourette disorders means is a neurodevelopmental disorders characterized by multiple motor tics and at least one vocal tic that persists from for more than 1 year with onset before 18 years of age. What is the definition according to DSM-5? Tourette disorders is diagnosed when mm, multiple motor tics are present, at least one vocal tic is present, not necessarily at the same time. Tic persists from more than 1 year. Symptoms begin before 18 years of age. Symptoms are not caused by drugs or another medical conditions. Introduction: Tourette syndrome is a chronic neurological disorder. Tics are sudden, rapid, repetitive, non rhythmic movements or sounds that occur involuntarily. Symptoms usually begin in childhood and often improve during last adolescence or adulthood. Epidemiology usually begins between 5 and 10 years of age, more common in boys than girls, often associated with ADHD and obsessive compulsive disorder (OCD). Etiology: the exact cause is unknown, mainly genetic factors like strong family history, hereditary predispositions, neurobiological factors like dysfunctions of the basal ganglia, abnormal activity in brain circuits controlling movement, imbalance of neurotransmitters, especially dopamine. Environmental factors: prenatal complication like low birth weight, maternal smoking during pregnancy, severe stress, risk factors, family history of Tourette syndrome, male gender, ADHD, OCD. Types of tics or motor tics. Simple motor tics: eye blinking, facial grimacing, shoulder shrugging, head jerking, nose twitching. Complex motor tics: jumping, touching objects, twisting, repetitive movements, and mimicking another person's actions. Vocal tics. Simple vocal tics: throat clearing, coughing, sniffing, grunting, barking sounds. Complex vocal tics: repeating words or parasis, repeating another person's words, repeating one's own word, involuntary use of socially inappropriate or obscene words. This occurs only in a minority patients and is not present in most cases. Clinical features: motor symptoms, frequently winking, shoulder shrugging, head jerking, facial movements, repetitive body movements. Vocal symptoms: throat clearing, sniffing, grunting, repetitive words, repetitive sounds. Behavioral symptoms: difficulty concentrating, impulsivity, anxiety, emotional distress, social embarrassment. Associated disorders: ADHD, OCD, anxiety disorders, learning difficulties, sleep disturbances. Diagnosis is based on clinical history, observation of tics, DSM-5 criteria, neurological examination, psychological assessment. There is no specific laboratory test for Tourette syndrome. Differential diagnosis like differential Tourette syndrome form persistent motor tic disorders, provisional tic disorders, seizure disorders, movement disorders, drug induced tics. Management: psychoeducation, explain the disorder to the child and family, reduce stigma, encourage acceptance and support. Behavioral therapy, habit reversal training, comprehensive behavioral interventions for tic, relaxation technique, stress management. Medication may be considered if tics are severe and interferes with daily life. Examples include certain antipsychotic medication like alpha to adrenergic agonistics. The choice of medicines depends on the patient's symptoms and should be made. Educational supports inform teachers about the condition, reduce unnecessary stress, provide classroom accommodation when needed. Nursing management assess types and frequency of tics, severity, triggers, school performance, emotional status, family coping, presence of ADHD or OCD. Establish a therapeutic relationship. Be calm and supportive. Accept the child without judgment. Encourage expression of feelings. Reduce stress like maintain a calm environment. Encourage relaxation technique. Identify and reduce tic triggers. Promote self-esteem like praise achievements. Encourage participation in activities. Prevent bullying. Support positive peer relationships. Medication management. The nurse should administer medication as prescribed, monitor for effectiveness, observe for adverse effects, educated parents about medication adherence. Family education teach parents nature of Tourette syndrome. Tics are usually involuntary. Avoid criticizing or punishing the child for tics. Encourage regular follow-up. Support school participation. School collaboration, educated teacher, encourage understanding among classmates when appropriate, reduce stress in the class, monitor academic progress. Rehabilitation, social skill training, counseling, vocational guidance for older adolescents if needed, community support. Complication, low self-esteem, anxiety, depression, social isolation, bullying, academic difficulties. Prognosis. Many children experience improvement in tics during adolescence or early adulthood. Although some continue to have symptoms, early treatment and strong family and school supports improve quality of life. Prevention. There is no known method to prevent Tourette syndrome, but early diagnosis, early behavioral intervention, family education, school support can reduce complications and improve functioning. Role of the nurse. The psychiatric nurse should assess tic severity, educate the child and family, reduce stress, promote self-esteem, monitor medication, coordinate care with teachers and other healthcare professionals. Thank you for watching. Jai Jagannath.